So I want to talk a little bit about what the qualities of a good therapist are. Hi, my name is Dr. Natalie Jones. I'm a licensed therapist. I have a post, or excuse me, a comment from a commenter here who says, "May I ask you if you've had the same therapist since 2009? What are the qualities of a good uh, therapist in your professional or personal opinion?" Thank you for asking that. So, yes, I've had the same therapist since 2009. I have not changed. I think a good therapist, there's a lot of good things that make a great therapist. I think a good therapist is going to, challenge you. I think sort of lean in to you and have you challenge yourself to, um, to help you stop being rigid and to also grow, right? You want to grow, you want to become mentally strong, you want to become mentally healthy and self actualized. A good therapist is one that enjoys working with people, um, but also practices what they preach. Since I've started working as a therapist, there's a lot of people that that I know that are therapists, but they would never take their own advice. So they're literally advising clients to do something that they would never do, and that feels very inauthentic to me. So, for example, if a therapist is saying, "Oh, well, you probably need to go every week," but they say, "I don't need therapy. I would never go to therapy." That kind of stuff. It sounds ironic, but I can't tell you how common that is within the field. So, just sort of walk in what you practice and what you teach. A good therapist is one that's also going to, they understand, some of the things that clients present with, but they also hold the boundary. So, for example, if a client has attraction or a client is pushing a boundary, they can make space for that, but they can also to process that, like in terms of what that's all about, but also maintain the boundary and, not have sex with their clients or not hang out with their clients, and become friends with them and so on and so forth. Also, what makes a good therapist, I think, is one who is culturally sensitive and culturally aware. I think that's very important. So just having that awareness there and just sort of being able to talk with different people about different things. And so there's that. I believe it's also good to be able to conceptualize a client. So conceptualize means that they, after a few sessions, or even after, even during the first session, they could kind of get an understanding of you, and then be able to present that back to you, like, here's what I'm hearing, here's what I think your pain points are, and here's how I think we can structure our work together to tackle these things, right? And be able to explain it to you in a way that you get it and you understand, but also it's very collaborative, and there's room for error, or there's room for other things to come up, and there's an understanding about that, and just being able to be able to explain that to you or even to another professional. Um, and I say that because it became very apparent at my last job. This was something that was hammered into me in my school, and I've had a lot of school training and things like that. There are a lot of people who cannot conceptualize clients. They cannot talk about what their clients' problems are, or what sort of treatment they would use and how they would go about um, using that treatment. So there's a loss. There's that. I don't know if it's like a dying art or something, but just over these past few years, and I've seen it a lot. No shade to anybody out there. I've seen this a lot with online schools. In some of the online schools, at least here, I don't know about anywhere else. I know that some of them don't seem to have like internship requirements. So for example, like when I was doing my internship, like every few weeks they would have to write in that we've worked on, like my school would give like a rubric, and you had to like work through the rubric, and then like a supervisor would have to sign off that we've worked through this rubric in a number of ways. So one of that would be conceptualization, and conceptualization usually comes through both individual, but a lot of it comes through like group supervision, where you have to present a case in front of your peers. It was also something that I had to do in comps. So comps is basically where you have to give, like, at least when I was going to school, it was like an ethics exam, and then you had to do like orals. So you would have to like present a client in front of a panel of like counselors and psychologists and things like that, and they would they would give you like a fake client, and then you would have to give like an oral exam, and talk about like what these things are. So I think that's a skill as well. And going back to the cultural awareness and sensitivity, I think that's important because sometimes I'll have people of different races, different ethnicities come to me, and they'll say, "Oh, I think this is something, this might be a product of being raised in an all-white family or an all-black family," and sometimes it's like you have to explain to people that like unhealthy is unhealthy is unhealthy, and a lot of people have dealt with a lot of the same things, both within the U.S. and outside of the U.S. So just being able to have that sensitivity and awareness. I think there's also the important element of like to be a good diagnostician. So a lot of times you have to explain, or you should be comfortable explaining like diagnosis to patients and things like that. Because there's a lot of people who like, oh, I took this Myers-Briggs test online, and I have this, I have borderline, I have all these things, or all these things are going on with me, and I've diagnosed myself with ADHD and things like that. And so you have to be able to be a good diagnostician and tell clients yay or nay, and why it's yay or nay, and what the recommendations are. Um, I think it's also good for therapists to have crisis training. Um, I don't do too much of it now, but I have quite a bit of experience with crisis training, both with domestic violence, but also too with hospitalizing patients, or even making child protective or adult protective services reports. A lot of therapists that don't like doing that because there's a lot of red tape, or they don't want to have to deal with the hassle, or they just don't know how to do it. So I think it's always good to be able to know how to manage, crisis with people, and be able to direct clients and hold that boundary, because sometimes things happen. People become psychotic. People may become suicidal, and you have to be able to say, you know what, I want to keep you safe. Sometimes you want to get buy-in, but really buy-in is not necessary. And I know that may sound harsh, but like you have to put yourself in the role of the expert to sometimes be able to make decisions for people that don't have the capacity to make them. And so I've worked in a number of roles where my career has allowed me to do that. Anything from recommending conservatorship to hospitalization, CPS reports. And a lot of times I'll walk people through that, um, and I'll tell them, and I definitely, if at all possible, I make it collaborative, unless somebody says they're going to kill me, and then, we're not so collaborative anymore, but, I always try to like let people know what's happening and why, and let them know that there's still a mutual respect there. And they seem to respond well to that. So let me know. This is a good question. Thanks so much for asking that. Like, comment, and share. Thanks so much.